Welcome to Raregivers 2023. My name is Crystal Barrett O'Loughlin. I'm founder and CEO of Angel Aid, and we're here today to talk about medical trauma. I'll go into that a bit later, but for the moment, I'd like to introduce you to what our Raregivers campaign is all about and how you might be able to support our work. Raregivers is a movement. We are, as an organization, a global nonprofit network of networks. We provide personal connection and emotional support to patients, to parents and caregivers, and to the professionals that are supporting these families around the world. We do that in rare, chronic, and complex disease communities. And we know that our families and our professionals are feeling isolated. They are feeling overwhelmed by these experiences, these very medicalized lives they are now living. And our hope and our intention is to deliver daily compassion and relief to these families. In fact, our goal is to support 3.5 million rare givers by 2026. And the only way we can do that is with your support. So thank you very much for considering a donation to Angel Aid. And if you're a Microsoft employee watching this broadcast, we ask that you do your donation via Benevity at aka.ms/Angel Aid in order to receive the matching grant opportunity during the month of October. If you're outside of the Angel Aid network or the Microsoft network and you're in the Angel Aid network, please donate via angelaidcares.org/give. And we do have a donation guide both on the websites and here in the slides. Just know that every dollar you donate makes a huge difference to supporting our community. We're providing weekly and monthly support groups. We're providing wellness kits, including kits for needle fear and needle phobia for children and young adults, teens and tweens. We're providing respite retreats, the opportunity to take a few days and step into self-care. And of course, our Archangel community is sponsoring the work that we do around the world. And this all came about because of my parents. So this is a very personal mission to me. And I will say that my parents are the strongest people I know. Richard and Phyllis Barrett met in high school. He was captain of the football team and she was head drill team leader. They wanted a very large family, so they married at 19 in 1963, and they had 5 kids, a basketball team of kids within 8 years. You can see my oldest brother, Richard Adam, there, and I'm the youngest. And you may be able to tell from the photo that David, Jared, and Randy had coarse facial features. They were not quite developing the same way as Richard and I. And in fact, they had carried a rare genetic disease called mucopolysaccharidosis, or Hunter syndrome. Hunter claimed the life of all 3 of my brothers in the 1980s. Randy passed away at 12 years old, David passed at 18, and Jared passed at 19 years old. And our whole family was wrapped up in the caregiving for my brothers. 4 children in diapers, clearing lungs at night. It was a very, very difficult period of time. It was a dark period in our family. There was a lot of joy, a lot of connectedness and love with my brothers. But when they passed away, it really broke our family apart. My parents divorced, and we all sort of scattered to the winds to deal with our grief. And if you stick around through this broadcast, I will share with you a story of just love and forgiveness and redemption that has happened within the Barrett family. But this is very typical. The stressors from a caregiving standpoint can be quite intense upon a family. And I've spent a lifetime thinking about suffering really trying to understand what is the purpose of the pain that we go through in life and in our families, because we're not unique. The Barrett family, we do have unique circumstances, but the pathway of suffering is a common experience in humanity. And I've lived in this world for so long, I can tell you that our stories resonate because suffering really sows the seeds of empathy, that in the process that you go through of these suffering experiences, your heart is being marinated in a way that makes you more receptive and more available to those who may be suffering around you. So, whatever difficult circumstances you have or are going through, just know that that makes you approachable. It makes you available to others. And in fact, in our world, in the rare disease space, this is a global necessity. We need it more than ever. Rare is not rare. Rare diseases impact more people than AIDS and cancer combined. There are over 10,000 different types of diseases that are classified as rare. And in fact, 350 million people are suffering from a rare disease. That's greater than the population of the United States. So this is a hugely prevalent challenge. And the biggest issue is that we have no cures for any rare disease. It's shocking. We've done so much in the name of science and research. And I do believe in our lifetime that we will see cures for these diseases. Right now, we have treatments for about 5% of rare diseases. So still a ton of suffering, more suffering than we can ever imagine. And I call it empathy math. 350 million patients and caregivers times 0 cures means that we have essentially a global mental health crisis on our hands. And it is a fundamental human right to not only be in pursuit and have access to the benefits of the physical health impacts we can have on our community and in our society, but also on the well-being, the emotional impacts. So emotional health is just as important as physical health. And this is the category that we are providing our services within the United Nations Sustainable Development Goals. These are our Raregivers offerings to the world, is to deliver well-being. And in fact, we've been growing exponentially. Thank you to your support. We have grown from 7 women in our living room in 2019 to over 15,000 families today. We have 22 psychologists and mental health and wellness practitioners in our practitioner network, and we've delivered over 21,000 hours of wellness training just in the last 6 years. So if it wasn't through your support, we wouldn't be able to perform these services. So please do consider making a donation to Angel Aid today. And those that have been our supporters, especially our sponsors and our corporate sponsors and our patient advocacy supporters. So thank you to all the pharmaceutical industry sponsors listed here, as well as those patient advocacy groups. And most recently, the National Organization for Rare Diseases, who has supported our work and endorsed our approach, the Raregivers Emotional Journey Map, which I'll talk to you in a moment. Really appreciate also those volunteers and supporters from Microsoft who really built our website, our mobile app, launched our mental health methodologies, and then most recently our support from Tuttle Click Automotive Group and the Ford Company. So thank you. You might also have noticed on that slide of logos was the purple. And I have something exciting to announce to you. So Purple is actually a calming companion. This little guy or gal, depending on how you want to associate, is a calming device. You hold the Purple on your chest, and as you pet the Purple, it will start purring. You can hold it up to your ear and you'll hear the gentle purrs. So this is a calming device. It's one of Time Magazine's best inventions of 2021. And so we're going to give you an opportunity to win a Purple. So any donations that are made during this October Give month will be entered to win a Purple Calming Companion. So here are the QR codes and the links to make those donations, and we want to thank you for that. Also want to thank our volunteers and donors. Without volunteerism, assembling our wellness kits, helping us during events, and without donors to help support our work, we would not be able to bring the relief that we bring. And in the last 12 months, I will tell you, we've been bringing more relief than ever. In fact, we've been going across borders. We just hosted our very first Spanish-speaking Rare Mothers Retreat outside of Mexico City. For 2 years, we've been working towards getting ethics review in Australia so that we could host our Sustainable Caregivers Retreat for families living with epileptic seizures in their loved ones. And this past summer, we developed and led our first Rare Men's Retreat at Barrett Family Ranch in Orange County. So thank you again. All we do all day long is witness. We are here to witness the emotional journeys and to teach the community how to witness the emotional journeys that rare families and chronic and complex disease families are on. Really, when life gets medical, everything changes. And you are now on this island of emotion, right? You've been noticing change in your loved one, and that has all the associated fears and worries and anxieties that show up. Going through the diagnostic odyssey and the overwhelm and the fatigue that comes from day in and day out of doctor's appointments and waiting for test results and trying to get answers. And you may very well receive a diagnosis and then receive, especially in the rare disease space, the other shoe drops, which is there is no treatment or cure for this condition. And you're really on a pathway of mourning what you thought motherhood or fatherhood was going to look like, what you thought life was going to look like in yourself if you're a patient, or what you thought you got into your professional line of work was to bring positivity, and you're now stuck in a cycle of really distress. And we want to recognize, we want to witness those emotional states, the realities of shifting responsibilities and full-time care, and for so many of our families, the end of life experience or worrying about the end of life experience. So grieving is present throughout this medicalized life. You may be grieving the life you thought you were going to have, or you thought your loved one was going to have. And so much energy has gone into finding meaning in these experiences. It used to be the 5 stages of grief. Now the 6th stage of grief is finding meaning in this lived experience. There's so many different ways to bring relief, sustainable relief into your life. And we teach those skill sets in our programs as well. So again, thank you. This is the world that we live in, and this is the world that we're highlighting today. And in specifically one area known as medical trauma. And it's a very, very real reality, especially pediatric medical trauma. It is a stress response. It's a set of psychological and physiological responses of children and their families to pain, injury, serious illness, and medical procedures that sometimes can feel so invasive and so frightening as they're happening, right? So medical trauma may occur as a response to something that happened at one moment in time, or multiple medical events, especially in the lives of our rare families. So we want to just shine a light on this reality of medical trauma, and we want to hear a bit about some of the possible ways to relieve the medical trauma, but the most empowering thing we can do is talk about it. So here we are, we're talking about it today, and in fact, recently we had a working group panel. So one of the things that we do in the Raregivers Coalition is we focus on specific areas of acute distress. And pediatric medical trauma is one of those areas. So we've assembled a group of experts from around the world. And here they are listed here. And we won't be sharing the panel with you. That will be released at a future date. The panel discussion will be released at a future date. But I wanted you to know that this work is being done. And thank you very much to Jackie, to Erin, to Melissa, and to Jana for lending your deep expertise and your passion and your energy towards highlighting this part of living a medical life. And I will say that one of the best things we can do is recognize, but also name the areas, the moments that could cause these kinds of traumatic experience. Needle pokes is one of those areas. And there's so many things that we can do. Angel Aid has a whole program for relieving the impact of the stress response around needle pokes and needle procedures, whether they're IVs, blood draws, or injections. And so much of this has to do with control. How can you bring control back into what feels like an uncontrollable situation? And especially as a parent, as a caregiver, when you're bringing a child, or especially a baby or a young child into the hospital environment, are there things that you could do? Could you ask for a pediatric phlebotomist? Could you make sure that you've been well hydrated and that your baby or your child are well hydrated before they go into that medical procedure? Could you bring in comfort items or have the comfort hold as that child is going through their medical procedure? So there's so many things, and especially child life experts within the hospital are able to bring some of these practices into place even as the procedures are happening. The reality is about 80% of children who experience a critical illness or injury develop pediatric medical trauma. And so we want to be ahead of this. We want to highlight it, but we also want to be talking about what are the things that we could do to limit the impact emotionally, and then also recognize after something's happened. It's not our fault. You may be listening to this and it may be a post procedure reaction, but knowing that intrusive memories, nightmares, avoidance behaviors, being hypervigilant, those are all ways to spot serious symptoms within your loved one. And we want you to seek help for those, okay? So as we continue the work of the working group, we're going to be talking about it, and that's what we're sharing today. And then we're going to also be talking about how to bring relief. So Erin Horowitz is a dear friend and also founder of Empath Labs. Has developed a series of stuffies. These are tools. You know, Rufus the bear is for the type 1 diabetes community. My Special Aflac duck is a social robot for children with cancer and sickle cell disease. And then the Purble companion is a calming toy for children and adults that I mentioned to you earlier. So 95% of parents report that Purble helps their child calm down. So creating these aren't just toys. These are actual data-driven, focus group informed calming solutions, right? So having those available are part of the process of what we do, and also having a voice. So having a voice for what it means in a family, both for the patient, for the child that may be nonverbal, and for the parent that may have to witness and then orchestrate the appropriate response to these experiences. So Melissa Hogan is an expert in this area. She released a book called Afraid of the Doctor, Every Parent's Guide to Preventing and Managing Medical Trauma. And she is a licensed attorney. She's a very, very dear friend, and she has allowed us to replay a portion of a webinar that we conducted together. It's an hour-long webinar, so we're just going to replay a portion of it. But if you would like to watch the full hour, you can go to angelaidcares.org/events and register to watch the full hour on helping rare families manage medical trauma. And I can tell you that it's helping any family manage medical trauma, is really how this was presented. So let's take a moment and hear from Melissa.
So when I was looking at preparing for this session, I debated, do we talk about medical trauma as it affects caregivers or as it affects our children or both? And we're really going to do both, but we're going to start with the caregiver because our mental health really affects and permeates everything related to our children as well. And remember, like I said, this is a flyover, so there's so much more to learn and in the way of strategies for parents and for children. And even for healthcare providers. So let's start by grabbing your pen and paper and divide it in half, divide your paper in half by making 2 columns and label one me and label one my child. So as we go through the session today, listen for me and I'll prompt you to make notes in one or both of the columns. So I want to start from the perspective that we are all on a journey. Of course, we talk about our life's journey, but we're all actually on a medical journey as well. And I elaborate more about this in the book. You have your own medical journey. Your child has a journey. And then you have a journey together with you as their primary caregivers, who I'm expecting many of the people on today. Does that make sense? There's overlapping perspectives, but for you personally, the things that you have experienced, they don't affect you in a vacuum. Whether it's your medical experiences as a child, surgeries maybe that you've had, or procedures, even as an adult, and then your experience as a caregiver, it's all part of your medical journey. And then that overlaps also with your child's journey. And then obviously that might overlap with other adults that are in their life as well. And so some of this information, you might think, oh, that's not really helpful right now, but take what you will from today that might be helpful for you where you are right now, given your past experiences. So let's look at your paper. And in the columns for you and for your child, start by writing down at least one medical event or experience that you expect to have in the near future. So whether that's an appointment or a surgery. So write down one for yourself and one for your child, and keep those in mind as we walk through the things today and how the strategies you're learning might apply to those specific experiences. So first, let's talk for a few minutes about what exactly is medical trauma, and then also what might be confused with medical trauma. So here are a lot of big words that are different ways of really saying the same thing. Some people say medical PTSD, medical traumatic stress symptoms, but we coined the term and are using the term medical trauma because that just summarizes everything. And medical anxiety, when I say that can be several things. So that can be a precursor, so something leading up to developing that trauma. It can be a symptom of the trauma that you have that anxiety, or it can be a standalone, somewhat milder version that never develops into full-blown medical trauma. But these strategies that we're going to talk about help, whether it's medical anxiety, full-blown medical trauma. So we're just going to use that as a shorthand. So here is really the technical formal definition for medical trauma, especially in children: a set of psychological and physiological responses of children and their families to pain, injury, serious illness, medical procedures, and invasive or frightening treatment experiences. But this is really what it is. It's emotional and actually physical reactions to scary medical stuff. When I say physical, it's more appropriately, like I said earlier, physiological. So it's deviations from the normal healthy functioning. So think of that quickening breath, that tension. And we're going to talk a little bit more about that as we get into some of the symptoms. So who is likely to develop medical trauma? So surprisingly, it doesn't matter if someone has a condition that is technically severe or rare or chronic, like I'm sure a lot of the people in this room or our children have. Really, anyone going through medical treatment can develop medical trauma, even when the appointments are not necessarily something scary, but it's how that person experiences those events, and which then draws back to their experiences prior to coming there. So it can happen through vaccinations, but here are the factors that make it more common. If they've had other traumatic events, females are more likely to experience medical trauma. If they use certain types of unhealthy coping, like avoidance, and then also the more of the tough, frightening experiences that a person or a child has, the more likely they are to develop medical trauma. But it can happen after one event as well, like I said. So there was a study many years ago that many of you may have heard of called the ACEs study. And that's the Adverse Childhood Experiences Study. And it looked at the items that could be potential for developing trauma. And it varied from things like divorce to different types of abuse and neglect, poverty, violence, and illness. So, for example, someone who has a high ACEs score, who has the likelihood of other traumatic events, would then also be more likely to possibly experience medical trauma. So in your columns, think about these things and consider whether these might apply to you or your child, and jot down any notes that you might want to remember later. So sometimes it's hard to know whether something is a symptom of medical trauma or other trauma, or versus one of these other problems. So for example, behavior problems, they could be related to medical trauma, or they could possibly be related to your child's actual medical condition. Some of the rare genetic disorders, such as Hunter syndrome that affects my son, have behavioral problems as part of the disorder, or autism spectrum disorder. So, or it could be pain or something else. So similarly, we as adults, we can experience mental or physical health challenges related to genetic predisposition, situations in our life, abuse or other trauma. So looking at, the things listed here, you need to ask yourself a few questions if you're seeing possible symptoms of medical trauma. Ask yourself, when did it develop? Is it common in you or your family? Is it common to other health conditions that you or your child may suffer from? Is it something that happens when your child or you normally experience pain? So that could be the cause. And then also to consider other traumas and stress, to try to look at and see, is this really medical trauma, or is this, something else? So this is one of my favorite quotes when talking about trauma. Trauma creates change you don't choose, and healing is about creating change that you do choose. It emphasizes that we can't always control, or usually can't control, the events that cause trauma in our life. That's often why they're so traumatic, is a lack of control. But healing is an intentional choice. And so I want to thank you for being here today, because this is a part of choosing a path toward prevention and healing any medical trauma that might exist in you or your child or might develop later.
Such wisdom in Melissa, and we're so thankful that she allowed us to partner and share that wisdom with you as part of our Raregivers broadcast this week. So just remember, if you'd like to hear the full recording, you can go to angelaidcares.org/events and then register to watch the full recording of managing medical trauma. And throughout the month of October, we have been celebrating our global festival of wellness. We've been highlighting practices that we think will bring therapeutic benefit into your world. So meditations from Padma Gordon, our Fitness Fridays with Raya Arthur. We've been bringing amazing, internationally renowned experts and authors during our Author Talk Tuesdays, highlighting various individuals during Wellness Wednesdays, and on Thursdays, bringing in our caregiver stories as a way to inspire you so that you know that Angel Aid is making a difference in the world, and also that we need your support. So in viewing these different opportunities, you can find the full calendar of events at angelaidcares.org/give. You can also visit our YouTube channel. We're posting these up at Angel Aid Cares every day as we complete them. And I did promise you a love story, and a love story like you would never believe. So remember that couple, Richard and Phyllis Barrett? My parents, they married in 1963. They lost 3 of their 5 children, and they did divorce because of the stress of that experience. They each remarried, a second marriage, and divorced again. They each remarried a third time, and they were married to those spouses for over 20 years. Lots of healing and peace found in that experience. My parents widowed each of them from their third spouses within a year of each other. And it was the same year that our daughter Chloe was born. And the joyousness of Chloe coming into the world, their granddaughter, actually brought them into conversation about forgiveness, into conversation about empathy and understanding and this shared collective experience. And although it was filled with so much tragedy, it was also fundamentally filled with love. And so Richard and Phyllis Barrett married again 60 years after the first time around in 2023. So I just thought I would share that story with you. I hope that you find some elements of love and forgiveness for people that have been important in your life. And I invite you once again to donate to Angel Aid. You can do so via angelaidcares.org/give, or if you're a Microsoft employee at aka.ms/angel aid. Thank you very much, and we look forward to connecting with you. If there's anyone in your community or in your work, home, or societal communities that you think would benefit from our support services, our weekly support groups, and our quarterly retreats and our daily mailings, please visit angelaidcares.org or follow us on social media. If you're interested in the Raregivers emotional journey map that I talked about, our witnessing tool, you can download that for free at raregivers.global. And if you are part of the industry and would like to be part of our coalition, you can join the coalition also at that website. So again, thank you so much, and we'll see you on the next edition of the Raregivers broadcast.